Hi ladies, and it is time for another update. I'm sorry that I have been kind of off the grid these last few weeks and not updating you guys, but a lot has happened. It's been a pretty crazy few weeks. The biggest thing of that has happened in the last, in case you guys, the 5-6 week update to the last 3 weeks is that Sawyer's actually had his heart surgery and he's doing great. So he's not home. After what happened after I left you guys last time is that although he was starting to do well with his physical therapy and stuff, he was showing great signs of improvement. All of a sudden he started to his work of breathing just got really difficult, and they had to up his oxygen, and they didn't want to up his oxygen too much because that affects the heart. And so it was time, and many obstacles came in because we were just in this holding pattern waiting for UCSF to have availability and space for his surgery. And then they thought he might have this bladder infection again, so then he couldn't go to UCSF, but his breathing was getting worse. It was just this whole nightmare that there was lots of tears and lots of setbacks, but we did end up he didn't have the bladder infection again, and we ended up being transferred to UCSF for his surgery. He was transferred there on a Friday, and he had his heart surgery on August 21st on a Sunday. They wanted him to spend like a day and a half there so they could get to know him and everything. And his breathing was just so scary, guys. He was just really pulling, and you just don't want to see your baby struggle like that. So in the end, they were giving him morphine to actually sedate him because he was working so hard. And I guess he was working so hard and he couldn't breathe, so he was getting upset because he couldn't breathe. But then the more upset he got, the worse his breathing got. So it was just this vicious circle. So it was horrible. That last week was terrible. But he had his heart surgery. He was the first surgery of the morning, and it lasted about 3 or 4 hours. And I thought I was fine until I wasn't. They wheeled him away, and they had put him on a heating pad, and he had started screaming, and they're like, okay, this is where you have to say goodbye. And, Sawyer's sitting there in his bassinet screaming, and it was just horrible. And I was fine. I held it in and kissed him goodbye and told him that I loved him. And I said, it's for your own good. I'm sorry that this has to happen to you. And by the time we got back up to the room, I was bawling. So, anyway, the best news is that they went in there, and after a 3 to 4 hour surgery, all of 3 of his heart defects were fixed. So he had 2 small holes in his heart, a hole between the bottom 2 chambers and a hole between the top 2 chambers, and there's a valve that sends blood to the whole body that is supposed to close off, because it also sends blood to the lungs. It's supposed to close off when a baby is born, either at the end, like in utero or right after. And in Sawyer, it did not close. It's supposed to close that entrance back into the lungs, so it's only supposed to send blood to the whole body. And his didn't close, so that was actually cut and repaired, and so it's now closed, so it's now doing what it's supposed to. And everyone kept telling us that the surgeon, Dr. Reddy out of UCSF, is basically like the surgeon, like in the world. He is the cardiac pediatric surgeon. He's like the dude. He is apparently world renowned and highly skilled. And we met him, and he was a very nice gentleman, and he was apparently the dude to do it because he repaired all of his little defects. And they prepared us for what he would look like afterwards. And I think that they were expecting us to be more scared or shocked or something, because a lot of parents, they're not used to seeing their baby with tubes and all of this stuff. And I thought it would be scarier, but I think because we've been in the NICU since birth, and because he had the breathing tube, and you know, just he's had blood draws and plugs and all this stuff like on him for forever since I've known the kid, then it was less shocking than I thought it would be. The image of him post surgery, you have there's also obviously the incision, which is closed with a little strip of cloth, so you couldn't see it, you knew it was there, but then there's a chest tube, and the kids can get between 1 and 4 chest tubes, and it's in their, the upper part of their abdomen, and it's for drainage and stuff, and it was kind of gross to look at, because obviously it's draining blood and other secretions, but yeah, it wasn't as hard to see him post surgery. It was hard because I knew that this was it. We've done it. This is what we've wanted since he was born, this heart surgery. So yeah, it's hard to see your kid in pain, but he was so, knocked up on drugs and stuff. He was sleeping, so he wasn't really in pain. But just knowing that this happened and everything, that was kind of overwhelming, the whole emotional part of it. But he since then has just been a complete champion. All the bad luck that we've had up to that point of surgery and all the setbacks that we've had, that hasn't happened. Knock on wood. Oh, excuse me, ladies. But yeah, I'm obviously exhausted still because we are going there every day. We are not staying in the hospital. Although they do have a parent room and they have a Ronald McDonald House. If you live a certain amount of distance away or something, they offer families beds so they can stay in the hospital with their baby. But yeah, so we've been going and visiting him every day. We stay for like 6 or 7 hours, and just hang out, help with his care and changing his diapers, and yeah. So post surgery, they have a million wires and plugs, and they're hooked up to, I think it was 6 different plunger things with medication in it, and a million different IVs. He had an IV in his neck, and then eventually he had to have one in his head, and he had IV in his wrist and his foot, both feet, and he's got this chest tube. So at first there's just so much, but the nurse the first day, she said, "You'll be surprised at how quickly all of this stuff comes off." And I have been shocked. I mean, it's now the 27th. So we are 6 days post surgery, and Sawyer is free of almost all wires except for the regular sensor wires that they need. Just a little sensor pads that go on his body, and let's see, and that's it. Those are the only things that are connected to him. Every day he was making huge strides. Sorry again, guys. I'm so rude. I'm sorry. But yeah, so every single day, more things came off and less plungers were going, and it was just it's amazing how fast babies recover. The doctor told us the first day, to prepare us for the surgery, he said that most babies go home between 7 and 10 days post-surgery, and that's just insane to me. Children go home 7 to 10 days after their heart has been opened. It's just insane. Just technology and medical science is just amazing. So they do not think we will be going home 7 to 10 days, but he said that because Sawyer has been ill and had that extra fluid on his lungs and all of that, that he could take a few extra days, and we still have to get feeding underway, and that's the biggest thing. That's our biggest hurdle. So at this point, I don't want to go into too much like medical ease for you guys, but he was pre-surgery. He was on the nasal cannula, the high flow, the tubes in his nose, at a 6 liter. That's a pressure at like 100%. So it was basically pushing pressure into his lungs to help him breathe. And over this past 6 days, he has gone down to, I just checked on him now, and he is at a half percent liter, and at 70, at half liter, 0.5 liter, and at 70%. So he's almost completely off oxygen support. He's really, really close. And so his lungs and heart are just doing awesome. He had these little pace wires in, and those came out, and chest tube came out. And so basically he's, Brian put it best just a few minutes ago. He said he's almost just a kid. And I was like, yeah, almost just a kid. He's just like 2 small steps away from being just a kid. They did try, because his cannula pressure is so low now, they can try to orally feed him instead of, he still has the NG tube, so it's in his nose, and that's what he's been being fed with since he was 2 weeks old. But he's going to, they tried to bottle feed him, like a physical therapist came and tried to feed him via bottle, and it wasn't very successful. They weren't expecting him to drink a whole bottle, obviously. He's eating 95 milliliters, so it's just over 3 ounces. I think it's like 3.5 ounces, or yeah, just over 3 ounces. So he's eating a lot for such a young baby, but it's because he's so big. He's now 11 pounds 8 ounces. So they have him eating a lot, but he only, because he's supposed to be eating 95, and he only took about 10 milliliters. So we wanted better, but at the same time, he's just learning how to breathe, and he hasn't had to swallow liquid since he was just under 2 weeks old. That's what last time we breastfed, and Brian gave him a bottle at that point too, 1 bottle. I mean, so he has to relearn all of these suck, swallow, breathe skills and all of that. So but he's just, guys, it's amazing. It is just mind-boggling that they keep making these changes, and every day at least 1 or 2 things change. They're trying to really, they try to bam get these kids healthy and adjusted, and so they can go home. At this point, they don't know if we will go directly from UCSF back to Walnut Creek to kind of work on working him all the way down off that oxygen support, and to work on his feeding. But we'll know more in the next few days, because they need to see how he's tolerating the lowering of the percentage of the oxygen, because they tried to lower it too much today, and he started desatting, and that means that he was panicking and not breathing, not getting the amount of oxygen that he should. So that he's doing really well and really improving, but they need to be really careful with how much they push him, because he is still adjusting, and he just had heart surgery. So, his lungs are still working. They haven't had to work on their own since birth. So, his body has to get used to all of that. And he has to relearn to eat. And so the physical therapist doesn't want us working with him, like the nurse or me. The physical therapist wants to specifically work with him, because they don't want to create the negative connotations with putting things in his mouth. They want him to enjoy eating, obviously. So they're going to do that slowly, I think. Probably only once a day, trying once a feed, or 1 feed a day, to try to help him get back into it. But yeah, so I'm hoping that we can obviously go home from Walnut Creek, that all of a sudden he starts making these great strides and eating a lot more via mouth, but I'm not trying to push him. I want to bring him home. Obviously, my maternity leave is very quickly coming to an end. In California, we do get 12 weeks. It's 6 weeks of disability and 6 weeks of paid family leave. And that's quickly coming to an end. He's 9 weeks old now, so we're down to the wire of the last 3 weeks. So I'm hoping that we can get him home before then. And the doctors seem pretty confident that we'll be able to, but I'm not putting too much stock in that. I don't want to get my hopes up and then have them dashed. So, yeah, that's that. So, my son had open heart surgery and he is just a little savage. He's doing so well. Every day seeing, one less sticker on him or one less sensor, and it's just great. And just yesterday we held him for the first time post-surgery, so it's 5 days post-surgery. We probably could have held him before, but there was just so many wires. It's just, it's overwhelming. And, we don't want to push him too much. There's, a few things that we have to go over, like you're not allowed to lift the baby underneath his arms, or, you're not allowed to submerge him in bath water, and, things that, post-care that we'll plan on going over with us. And they said that even, post heart surgery, that some babies go home with a low flow cannula and, with an NG tube. They'll, like, if he's gonna have to go home with that NG tube, then they'll teach us how to insert it. They said there's like a doll. They give us training. So it's not like they're going to like just hand us a baby and say, okay, go home. And they make sure the parents are fully comfortable and the nurses are comfortable with the parents, or the nurses are confident in the parents' ability to handle this, wound care, all of that. So I'm feeling really confident that, when he comes home, we will be fully trained how to handle whatever it is, whatever support that he needs. Yeah, so it's just insane. Yeah, and so just a relief to watch him lay in bed and be able to breathe. Sorry. But, he's not struggling anymore. He's just taking nice deep breaths, and he just is doing so much better, and, being happy, and we're getting really close to getting a smile out of him. Really close. He does sleep smiling, and probably the cutest thing I've ever seen. They're not real smiles. It's probably gas or whatever, but just seeing him be able to breathe is just amazing. Because it's something we take for granted. And, once you get a cold or something and you can't breathe out of your nose, you're like, man, I wish all those times that I could breathe out of my nose, I really enjoyed it. It's just like that. I'm just really grateful. And the doctors have just been amazing. And what this man was capable of. I mean, think about it. His heart is like 1.5 inches long or something, and that big, and this little tiny itty bitty hole. I mean, it's just insane what they can do, that they have this talent to do that. And the dude in the world operated on my son, the dude. It's been a crazy 3 weeks, guys. Oh goodness. But that's a huge update. The girls have not seen him post-surgery until today. Our youngest daughter, Drew, you guys have met her. She came and saw him and got to hold him. And it's just really great. He's just so, when he's awake, he's so alert and looking around and, and listening to us and like totally into it and focused. And it's just, he's turning into the person he's going to be. It's just crazy and amazing. But yeah, this video is long enough. I just wanted to let you guys know he had his surgery, and we are so close to getting him home. It's just amazing. But yeah, so that's all for now, ladies. Yeah, just hope that he really, really gets this feeding under control, and that he can start handling this low supportive oxygen really quickly. And then hopefully we get him home before I have to go back to work. So at least we have some time to adjust a little. But yeah, so I'll be talking to you ladies. And yeah, crazy, right? My kid had heart surgery and he's like maybe days or just a couple weeks away from actually coming home. They're actually talking about, well, when you go home, this and this will happen, and that'll happen. It's just no one's ever talked to us like that before. So yeah, I'll be talking to you ladies. Bye.